This video of Nairobi Governor Mike Mbovi Sonko making an impromptu visit in Pumwani Maternity Hospital drew a lot of criticism, many questions arising on what the county government is doing to address the rot in the health sector.
You told me there is you lost one. How many dead babies are this now?
The governor proceeded to JKL Show to address the negligence allegations of doctors in the facility.
The negligence in Pumwani Hospital has been rampant for so many years. And I want to repeat myself, mothers in Nairobi County, when they voted for Sonko as the governor, they had a lot of hope in me. Yeah? They knew I will transform the health sector.
There you are talking in the pictures there. You can see
yourself.
I
want to, in this digital era, Jeff, you cannot edit a message. You cannot fabricate a message. I want you, Jeff, you put yourself into my shoes. Sunday, 16, 2018, I received a message from a concerned Nairobian. I want you to read this message to the public, Jeff.
This is what you got?
Yeah, on 16th, Sunday at 21:47, from a concerned Nairobian.
Okay.
Just read the message to the public.
It says, good evening, Your Excellency. I have gotten information that there's a problem at Pumwani Hospital after one theater was closed down and the sterilizing machine was closed from operating 24 hours by the hospital management. Babies are dying. Please make a surprise visit to the hospital to avert the looming dangers. You are the only hope. And this was at 21:47.
That's
September 16th.
When was that? On Sunday night. I was at my Mua family home, family farm. Nikashanga, because this touches the mothers. You'll allow me to use lugha ya mashinani.
Yes.
Pumwani ni hospitali inategemewa na wamama wa mashinani. Wamama wengi waliamka asubuhi saa 10, Jeff, wakaenda kuchagua Sonko. Wakijua Sonko ndio their only hope. So when I received this message, nilishangaa asubuhi itafika saa ngapi. I even called this number. This guy gave me a number of his relative who is a mother ambaye alikuwa ameenda kudeliver Pumwani, and she lost her baby. They even sent me videos of mortuary attendants wakipeleka bodies to the morgue, but the number of the dead babies wale walipelekwa morgue haikuwa namba ya kawaida, Jeff. Nikasema asubuhi itafika saa ngapi? Asubuhi ikafika. I left my home at 6 a.m. The OCPD industrial area is my good witness, and the OCS. I came and parked my cars there. Yeah. Nikavaa kofia compact. Nikapanda boda, Jeff, all the way to Pumwani. Incognito. Jeff.
Yeah.
Nilipofika Pumwani, nikaingia ndani. Nikapiga round, kwanza nikaenda labor ward. Luckily, there was a crisis meeting by the nurses who are about to strike and never be cheated. There is no understaffing in Pumwani. We have 161 nurses who work in 2 shifts. Nikaingia kwa hall. Nurses wakakuwa shocked by surprise. They were very happy. Wakaniambia, Governor, we are suffering. We want to strike, Governor. Ngambia, why? Number 1, we are the consultants as nurses. We are being overburdened. We are being misused by the doctors. Ask them why. Consultants do not report to work. So the nurses told me, Governor, tunalazimishwa kuzalisha. Mothers are suffering in the theaters. The surgeons do not report to work. Consultants do not report to work. Kwa nini? Wakaniambia, Governor, kesi zingine tunajaribu, watoto wanakufa tukizalisha, tunalemewa.
Months later, welcome to Pumwani Maternity. Sonko's administration working around the clock to refurbish this hospital.
Hospital. Tunaendelea na beautification na renovation. Kama mnavyoona, tunahakikisha hospitali zote za sub county na zile kuu za county kama hii Pumwani Maternity Hospital tuweze kuirenovate kidogo. Tunaipaka rangi ndani na nje, na kwa mavio pia tunazikarabati, at least tunaweka style za kisasa, kama ni tiles kwa ukuta, chini inawekwa ile floor kidogo ndo mtu asiweze kuteleza. Alafu pande wa shower pia tunawekea hot shower, ndo mama mjamzito at least akwe asikie vitu ni digital, kama anaoga na maji moto kuliko hapo awali kuoga na maji baridi, nawekea mpaka shower. Na pia sio katika hiyo hospitali ya Pumwani peke yake, tunafanya hii yote katika hospitali za county.
My name is George Nyadimo. I'm the Chief Nursing Officer of Pumwani Maternity Hospital. I must say for the last 5 years, of course not at a very high speed, but at moderate speed, changes have actually taken place. But this year, when we had the visit of the governor, in September this year, services have improved a great deal, and I must say this is one of the luckiest and the hospitals in the country, or in the county for that matter, considering the fact that the governor visits us here most of the time. And of course it puts us on notice and also puts us to have some pace of work. And because of that, the services have actually improved. It's also helped us so much in terms of infrastructure. So, new beds have been brought to the hospital. Renovations have taken place in the wards. And if you look at the environment around, it's really very clean. And he has brought for us some workers who have actually helped us to manage the cleanliness of the compound. And because of this, clients are actually streaming to the hospital in high numbers. Like now, if you go to labor ward, you'll find it's actually full to the brim. It is really full to the brim, and comparatively with the last 5 years, it wasn't like that. Patients are not really many as at now. I would say we used to have like 60 deliveries in a day, but currently we are having almost 100 plus sometimes deliveries taking place in a day. And on top of that, the patients are still there waiting to be attended to. Mothers who are laboring are still there. There are many. We conduct those deliveries, and this is because of the improved services of the facility. Health workers are actually putting a lot of efforts to make sure that they actually go by the pace of the clients as they come into the hospital. And we are working hard, and this is visible. It can be demonstrated by looking at the records. If you go to the maternity unit, you will see how many mothers are actually coming in, how many are delivering each day normally, and how many are being operated in our theaters. It is quite high. We have like around 20 cesarean sections each day currently, as opposed to some time back where we used to have around less than 10 taking place in a day. Then if you go to the capacity of the wards, actually it has actually increased because of the renovations. We used to have around 265 bed capacity of this hospital. Right now we are almost 320 bed capacity between September and now, and this is because of the renovations that have actually taken place, because of the governor's visit.
Nilikuja 25th jioni, alafu nikaenda theater nikajisaidia kituka saa 9 hivi, then wakanileta kwa hii ward, but iko safi, kuna shida, iko tu sawa. Hata vile wanatuongelesha wako tu sawa, kuna shida, sijaona shida yoyote. Chakula iko sawa, time wana keep. Sasa tumejua time ya kukula iko tu sawa, haina shida.
Kangaroo Mother Care Unit, reducing child mortality by the mother to child heat transfer.
I live at Shokal village. I'm a kangaroo mother. Actually, I gave birth to preterm triplets. They were 31 weeks, and kangaroo has helped me. When they were in the incubator, they used to increase slowly, but when I came to kangaroo, I can see they are progressing well. Actually, they are gaining weight by 40, 45. For my first triplet, he was 1.4 and now he's 1.7, and I've stayed here for 1 week, so he's improving well. For my second triplet, she was 1.3, but she's moving slow. I don't know whether it's because she's already she's 1.6, 60 something. So she's moving slowly, but we still have faith she'll recover with the others. But for the third triplet, he's gaining actually well. He was 1.4 and he has actually reached 1.8 today. It's just that we can't, we have to wait the others. Yeah.
I'm Betty Waboy from Joska, Machakos County. I came here on 6th December. The water broke when I was at home. I came to labor ward. They reviewed and found that I have 4 operations. This is the 5th operation. They took me to the theater. The baby was born at 1.2 kg. Then she reduced to 1.1. She came to the incubator. She continued to reduce up to 1 point. After I came to Kagaru, the baby has gradually improved from 1.1 to 1.4 today.
A renal dialysis unit has also been installed in Mbagathi District Hospital and a new standby power generator installed to sustain operations in the hospital.
Which we have here in our renal unit, and with our special doctors here, teaming up with our Kenyan doctors here, I'm sure kidney failures will be a problem of the past in Nairobi County.
Several other health centers have also been rehabilitated and equipped with the necessary equipment in various wards, including Embakasi Health Center, Kayole 1 Health Center in conjunction with UNICEF, Mukuru Kwa Ruben Health Center in collaboration with Congregation of Brothers FBO, Ngara Health Center and Isili Health Center.
But it's with our great excitement, we acknowledge that some of those words have been converted into action with Mheshimiwa Governor Sonko. Ameleta, ametoa zawadi kwetu. Tumepewa vitanda vingi kusaidia kazi yetu.
Our governor has done it again for us. He promised to work with community-based organization, and for sure he has kept his word. We received a donation of 15 modern hospital beds that are going to make sure that our women are comfortable when they're receiving their gift of babies here in our birthing unit. On behalf of Mukuru Kwa Ruben slums and on behalf of Ruben Center as an organization, let me take this opportunity to express our gratitude and appreciation to our governor, Honorable Mike Sonko, and wish him God blessings for standing with the people of Mukuru, ensuring that they will be able to access good services from here.
Asilimia mia.
100.
And we started normal operations of conducting deliveries at the facility in November last year. We have actually been very grateful because the community has responded very well. We do some social mobilization of letting the community know of the availability of our maternity because it's still new. We are selling it. So from there we have actually noted a very marked increase of the number of deliveries we conduct. We can actually confess and say that the community has faith in us by the number of clients and the patients that we receive. On the maternity side of it, we normally conduct only normal deliveries because we do not have a theater. But we admit those mothers, and in case of anything, we have an available ambulance. We also want to appreciate what the governor did, the governor kitty that he gave, because now we can be able to serve food to our mothers after delivering. We also want to appreciate the fact that we have an ambulance, because right now we can be able to rush our mothers to either Mama Lucy or Pumwani or the babies. Our maternity services are actually free. We do not charge anything. Whether we are referring, we do not charge anything. We actually give free services because we are there to help them.
Oxygen plant at Mama Lucy Kibaki Hospital has also been installed that is able to supply and sell oxygen to other hospitals.
One of the other successes of Mama Lucy Kibaki Hospital through public-private partnership is construction of an oxygen manufacturing plant. It's called the Hewatele Oxygen Plant. This was done in collaboration with various agencies, including UNDP, DFID, the British NGO, through UNICEF, through the county government of Nairobi, which provided the majority of the things that were done there. So what does it mean having an oxygen generating plant? First of all, to understand, oxygen is not a luxury. Oxygen actually is a drug, is a treatment option of which people who come, they need it, they find it. It really improves what we call mobility, that is the sickness, and mortality, that is in terms of reducing the deaths. The oxygen that is manufactured in Mama Lucy Kibaki Hospital is also put in cylinders and serves the other county hospitals, for example, Pumwani, Mbagathi, and the health centers. And also it serves other surrounding facilities. Like for example, we serve up to Embu County, Makueni, Kiambu County hospitals, we serve them. And that one earns for us revenue, which is shared in partnership with the various consortiums that have done the PPP. So when a patient comes to Mama Lucy Kibaki Hospital and needs oxygen, the oxygen is piped to the wards. Go to pediatric emergency, the newborn unit, the acute rooms, we have piped oxygen. So there is no issue of moving cylinders from one place to another. We have the oxygen delivered by pipes. So safe oxygen in Mama Lucy Kibaki Hospital has really reduced those indices. So I'm very happy and thankful to the various consortiums who have assisted us, and also to the county government of His Excellency the Governor for making this project a success.
In addition, a new building has been constructed at Mama Lucy Hospital. It has a 72-bed capacity. This will ensure that more patients are admitted at the hospital for better services. The launch of the TB Center of Excellence Laboratory, constructed in collaboration with the Japan government at Kangemi, has scaled up diagnostic services of TB in the area. The center is the only one of its kind in East and Central Africa.
This is the first modern TB clinic, sawa, in the whole Nairobi County and the whole Kenya, sawa. Sababu tunafanya hivyo, gavana wetu anajali maslahi yetu. This modern facility, fully equipped with the latest TB diagnosis equipment, will go a long way in early detection and treatment of this disease. The prevalence of tuberculosis in Nairobi stands at 12,870. According to the World Health Organization, approximately 29,000 people died of TB last year in Kenya. More than half of persons estimated to have the disease were not diagnosed or treated. It is our responsibility to ensure that patients are treated and that those infected get the right diagnosis, treatment, and care. Many people suffering from TB do not know it, and the disease continues to be the top infectious killer in the world. This is why this project we are launching here today is very important.
The governor has in his capacity facilitated the offsetting of 51 million shillings in the current outstanding debt of 285,600 million shillings owed to KEMSA. that has aided in flawless supply of medical services in all the county hospitals and health centers.
My name is Mohammed Sahal, County Chief Officer in charge of health services. I want to assure Nairobians that Governor Sonko administration is committed in transforming health sector by improving provisions of healthcare services in all our county facilities. In this year 2019, we have allocated enough funds to our supply chain management to ensure regular supply of medical commodities to all our facilities. We are also planning to implement all projects in Nairobi Regeneration Program to decongest Kenyatta National Hospital. Under these, we are planning to upgrade our 3 big facilities. These include Mbagathi, Mama Lucy, which we will very soon unveil new wards under construction, and Pumwani Maternity Hospital. Pumwani Maternity Hospitals, we have already started works. We have also upgraded 6 health facilities to level 4. These includes Bahati, Mathare North, Kayole 2, Langata, and Westland. We have also upgraded 4 health facilities to offer comprehensive level 3 services.
These are just but a few achievements by the county government. However, the governor and his administration is committed to delivery as promised during his campaigns.